Hi, I'm Kate Canny, and welcome to the first edition of Open Dialogue for 2012. This is going to be quite the year at United Healthcare, and we wanted to kick off our Open Dialogue series by focusing on two topics that will change how customers interact with us. You've been hearing us talking about affordability for several years now, but have you ever wondered just what it means and why it matters to those we serve?
What does affordability really mean?
The topic of affordability has been around for many years, so why is it so important?
What I want to know is, what impact can I have on affordability?
These are just some of the questions about affordability we posed to Dan Schumacher, United Healthcare CFO, and Austin Pittman, President of United Health Networks.
In the United States, we spend 2.5 times more per person on the cost of healthcare than any other industrialized nation. And we don't have any better result for it. We don't live any longer, our infant mortality rate isn't any better. And the worst part is that these costs are growing at an alarming pace. If you look over the last decade, the growth in the cost of healthcare has been 4 times greater than the growth in people's wages. What that means simply is that people either need to sacrifice something else to maintain their coverage, or they need to go without, both of which are unacceptable to us.
As you think about those things that are causing healthcare costs to go up, and we'll step away from whether that's medical technology advancements and those things that we could really argue about. If you think about something as simple as understanding how much something costs, and when you go buy a car, understanding what you're buying, what the quality is, what the cost is, and being able to shop that experience, that really doesn't exist in as robust a way as it should in healthcare.
Affordability is particularly important in 2012 because the reform law did not address the cost of care. It only addressed coverage expansion. And so our focus on our affordability agenda and trying to reduce the cost of care as well as the cost of administering care will be critical.
All of us can help in this affordability agenda. You know, and I think the first thing that comes to mind for me is to be thoughtful, right? Pay that claim accurately, answer the call accurately so someone gets a good answer and doesn't call back. It's being thoughtful in the way we approach our work and getting it right the first time. I think also not discounting an idea because you think it may be too small. Again, we've got teams of people, clinicians, scientists thinking about big ideas around affordability. But no idea is too small to think about how we improve quality of the work we do and the cost effectiveness.
There are 50 million people in the United States that are uninsured, and we have the opportunity to bring affordable coverage to all of them.
And ultimately serve our mission to help people live healthier lives.
We are in an era of massive change in healthcare, and with this change comes the opportunity for United Healthcare to lead our industry in a new direction and to serve our customers differently, helping them lead healthier lives. To help achieve this, we organized a group of leaders from across United Healthcare to develop a multi-year, multi-phase project to enhance our customers' experience. It's called United for Life. We sat down with Tom Paul, CEO of Medicare and Retirement, and the project's executive sponsor to learn more about United for Life.
United for Life is really our commitment to consumers, to be with them every step of the way. And what that means is to be with them at all stages of their health and their life conditions, so that we make sure that we're standing right beside them as they're navigating this complicated healthcare system. Regardless of the product that a consumer is in with United Healthcare, we're going to commit to 3 things. We're going to simplify their experience, we're going to personalize it so it means something to them, and we're going to let them know that we care about them as individuals. We're organizing around how we approach our systems and our technology and our processes so that we can make sure there's a consistency in experience for every individual, again, regardless of the product that they are associated with United Healthcare. And so it's important for us to remember that we're consumers, that our family members are consumers of healthcare, and we can use that to make decisions or to make commitments about how to make the experience better for our consumers, for our customers, for our family members, so that each day we can think through how I can make a difference, how I can change the lives of the individuals that we serve. And that in itself will drive United for Life. We've also put together a team of people that have been working collaboratively to really drive the United for Life initiative across each one of our businesses and across benefit operations and the shared services. So each one of you will have a key go-to that you can contact if you have questions or suggestions about how you can make United for Life better.
United for Life is just one of the programs United Healthcare is undertaking to make healthcare work better for everyone we serve today and those we will serve tomorrow. Now, let's go to Vegas.
We were approached by United Healthcare to collect cards for our troops, and so here at this convention we are grabbing both vendors and just guests here today and requesting that they sign a letter for our deployed service members who are currently in Afghanistan, Iraq, and Kuwait. So we're going to take about 2,000 cards today, distribute them between those three countries, and just kind of hopefully lift their morale of our local service members.
My son was deployed to Iraq. And he's back home safe now. And I actually remember him telling me once that he'd gotten a card. I think his came through the Red Cross. And he said, "Mom, it just really reminded me of home, and it just really gave me that couple of minutes of just real joy to be able to think about something other than the sand and the heat."
There was this one father, and he's scared, obviously, for his son's safety, and so, you know, he handed his business card over, and we'll make sure that once he gets deployed, he gets some care packages and letters, and so you can tell that meant a lot to him.
It's an opportunity for the community to help out and support our troops that are there in Afghanistan and Iraq and all these other places that we are right now. They need our support. They need our love. It shows them that people are thinking about them, even though things are dark at the moment. Somebody's thinking about them.
It's, as I like to call it, it's liquid love. Because, you know, United Healthcare, they didn't have to do this. There's plenty of other organizations and ways to volunteer.
The reason we picked supporting the troops is because everybody in the community has some sort of tie to a deployed military man or woman overseas, and we thought it was important to give back to them and let them know that there are folks at home thinking about them.
This story is amazing for several reasons, the most striking of which is how we were able to touch the lives of over 2,000 active duty personnel serving in combat zones. Well, that's it for this first edition of Open Dialogue in 2012. Thanks for watching, and we'll see you next time.